Okay. Oh, that's very loud. My name is Bisan Salhi. We're going to be starting this panel in just a minute. We are just waiting for one more of our panelists who's finishing up at another didactic, and I think we'll be here in just a minute. So, yeah, so just bear with us. We'll give her 2 more minutes, and if not, we'll go ahead and kind of get started. So.
Put our disclosures on. I don't know what the next slide is. Did we actually do our disclosures?
No, because we didn't have any, so they said we didn't need a slide. So.
Thanks for joining us.
It's okay.
No worries.
So hi again. So thank you all for being here on what we thought was the last didactic, but apparently is the second to last didactic, so we really appreciate your time. I am very happy to be here with my esteemed colleagues to kind of talk about the basics of qualitative methods analysis and just sort of like the next steps of how you kind of make sense of your qualitative data. We do not have any conflicts of interest to disclose, but I just want to say that this is a follow-up to a talk that we did last year about kind of data collection and specifically kind of how to do interviews and make the most of your interviews. If you didn't, if you made it to last year's lecture, welcome. If you didn't make it and you have questions, like that we can kind of cover just about like data collection, we're happy to do that. And just as kind of a disclaimer, when we made this talk, we are mainly kind of focusing on interviews as kind of the qualitative data, recognizing, of course, that that is one of many sort of forms of qualitative data that can be analyzed. And we're happy to kind of talk to, like, take any specific questions that you may have specific to your own projects or experiences or questions. So. Just as a brief reintroduction, qualitative research is a scientific method of inquiry and observation that focuses really on understanding phenomenon in depth and in detail to really allow for understanding of the world without the constraints of a predetermined analysis plan and a hypothesis. That's especially useful for developing a deeper understanding of social phenomenon, exploration of kind of an uncharacterized topic or complex human behavior, or to generate hypotheses. I want to also just kind of explicitly state that as opposed to kind of the implicit understanding and maybe some of like the basic or biological sciences that the world is a fixed way and that we can understand it through observation and or experimentation, qualitative exploration really privileges and understands the world as dynamic and variable and to be understood actually in a myriad of ways. And I think the idea is not to understand the world as it is, but to understand different perspectives and different ways of being in the world and to really, really be able to unpack that and to have a variable levels of understanding of ourselves and also of our participants and the people around us. Oh, excuse me. I really think about particularly, in my first introduction to qualitative methods and qualitative analysis, it really made a lot of sense to me because I had been practicing clinically for a long period of time by the time I had been kind of introduced to it. And for me, there's a lot of parallels between understanding the world clinically and kind of that clinical decision making and data gathering that has a lot of parallels with kind of qualitative research. And I say that because we sort of say that if you're kind of collecting like the interviews, that a lot of that is very similar to kind of getting like a chief complaint and the HPI and kind of figuring out what that means and figuring out like the nuances to the chief complaint may be chest pain, but through sort of conversation and and actually like exploration of the individual patient, you can figure out, well, what does that actually mean? And then the steps really like that we outline here are really kind of thinking about like the, generating a differential to figuring out an assessment and plan. And I will also say that like the steps that we outline here are a general approach that can vary based on personal experiences, the particular question, the particular participants and the context in which, the research is taking place. And so I'll give you an example. So when I did my PhD research, it was on the context of homelessness in the emergency department. And so I interviewed a lot of patients who were experiencing homelessness in the ED. But as a flip side to kind of my research, I also did a lot of interviews with actually like hospital administrators and clinical staff. You can imagine that like the context and the kind of questions and the conversations that one kind of has with a patient in the ED are very different than if you're kind of talking to your chief of service, right? And then there needs to kind of be that flexibility in kind of thinking about, well, how do I actually approach what is kind of being said? The other disclaimer that I really want to put up, and I want to make sure that we mention, is that when we're kind of talking about qualitative research, and particularly in this presentation, it's outlined sort of linearly as like you collect the data and then you do the codes and you make meaning of it. But in reality, the process is actually quite iterative and it's nonlinear. And it really begins during the process of data collection. So if we go back to kind of the idea, the analogy with clinical practice, one does not necessarily wait until all of the labs or radiology results are back before you start making meaning of it, right? It's like you start thinking about it in the first review of the vital signs, you think about it again in the HPI, and you revisit it, and at every point you're either confirming, denying, kind of generating a more complex understanding or a complex picture. And so similarly here, it really is an iterative process, and you kind of are always sort of going back and forth. Now, I want to also just make sure that we mention that just because things are variable and complicated does not mean that it is not rigorous and the analytical process is not rigorous. There's a really, it's very important to kind of establish the credibility or confidence in the result, the dependability to make sure that the findings can be repeated or understood in kind of a similar cohort of participants or coders, and that that there's a lot of confidence actually in the results that are derived kind of from the data. I will actually now turn it over to Dr. Padella to talk about theoretical frameworks.
Thank you much. So we're going to move to talk a little bit about theoretical frameworks. And for those who are Star Wars fans, you can see at the bottom that I have what should be called the holocron, but in the movies was called the Wayfinder. And the reason why I say that is because it is like that. The truth is out there somewhere. When I gather this data, I need to figure out how to get there, right, to figure out what I have. And so I would think about theoretical frameworks, not just something you put on your grant because you want to satisfy a granting agency's notion, but rather for you to help organize the way your research questions are going to be planned out, and your interview guides. We don't talk about that at this meeting, we did that last year, and the analytic plan itself, right? So it's really, truly a wayfinder in that sense. It will help you see the bigger picture in a rudimentary way. What am I trying to understand and why? So the other aspect is, so when you do get to dissemination, right, in your papers, people are going to ask you what your theoretical framework was. And there are heavily sort of used theoretical frameworks that people like to see as reviewers. So this will help them understand what you were trying to understand and why and how, and that will help your paper get published ultimately. And then, there's a caveat, right, as Bassam was saying about everything, that there might not be a perfect theoretical framework. You actually might be embarking on trying to create a theoretical framework for a phenomenon that you are trying to study. So that's kind of the reason. As I said, a simple way to think about it is to help you organize every aspect of what you're going to do. So here are some examples, I'll show you in a few slides, right, of theoretical frameworks that are large or small depending on what layer you think about. So this is more like a sociological, ecological, life cycle, right, with embedded layers of theory there. So you could say, I'm going to focus on one level or the whole thing based on what your research question is, right? So I want to understand the interconnectedness of all these levels, or I just want to focus on one aspect, and you can proceed that way. A common one that's used a lot in implementation research, and I think this is very good because most of us come from a clinical perspective, is the CIFR framework, right? If there's an outer setting, there's an inner setting, there are characteristics of individuals within that, and there's intervention characteristics. So when you're trying to do implementation research, you might think, again, about one aspect of this or all of it. Now, that helps you organize, as I said, both the research questions that you're going to propose, the individuals that you're going to interview, and the questions you're going to ask them. And then when you get to analysis, when you get that data, how do I put it into some sort of framework, right, to understand all these mounds of nice snippets of quotes. Another one here, so there's just a few different examples here, right? So this is related to kind of behavior change, another thing that we do a lot in the ER. And we think about these sorts of ideas of, does someone know about something, right? Are they engaged by this issue? Are they going to decide to act, and so on and so forth? So this is the precaution adoption process. It could relate to individuals or, again, even to a system. And one that I use a lot is this other one, right? Which kind of brings together what's classically known as the theoretical, the TPB, the theory of planned behavior, used to be called the TRA, right? And external sort of notions. So here you have 3 domains: behavioral beliefs, normative beliefs, and efficacy beliefs about some sort of action, like smoking cessation, for example. And then you move towards the behavior is the smoking cessation, but the most important determinant is the intention to quit smoking. And that's influenced by these other domains, right? And before those domains, each one of those beliefs are influenced by characteristics. My point, again, here is not to explain these models in detail, but to give you a sense that when you want to even study an action by an individual, or rather how a system is operating, these domains help you think about what you're going to ask and whom you're going to ask about, who you're going to ask those questions to, and then when you get to analysis, really help you explain what you did and what you found. So here's just another example, right? This one has now a hybrid sort of model of social cognitive theory, a sigma theory, right, about some decision making within the emergency medicine setting. So you have multiple embedded actors in this case: provider behavior, patient behavior, self-efficacy, and then there's an encounter that happens. So again, that's the point of these theoretical frameworks. I'm going to turn over in a second, but I want to show you what this kind of looks like at the sense of data analysis. That's what we're about today, right? So then you would have a frame, a conceptual frame, from a framework that you used that would help you set up the codes, right, that you're going to apply to the quotations from your participants. So it helps you create that model, that data code book, to then proceed down analysis and extract, as I said, what is out there. We want to find what is out there, but we want to organize what we did find. So if that makes sense, I'm going to turn over, right, at this point to my colleague. I'm sorry.
That's okay.
So as Dr. Salhi was saying earlier, this concept of this like linear analysis doesn't really exist in qualitative research. So the analysis actually starts during the data collection. So for example, are you noticing that people are reacting a certain way to some of your questions? Are they misinterpreting some of your questions? Are they asking some sort of follow-up question? And much like, as was mentioned earlier, as you are doing your HPI and developing your differential, you're sort of getting a sense from the patient what they're telling you. And we've all seen the patient sort of who comes in with chest pain, and then the family member shows up 20 minutes later and is like, no, they fell and they've been confused for 4 days. And so really getting all of that context so that one can appropriately analyze the data that they are being given, and certainly is a dynamic process. It can be sort of inductive or deductive, and so what that really differentiates is sort of whether or not we come to the question with a framework, or if we're really coming with no clear sense of what we're going to find. And so the example that I sort of think of is, for example, if one was visiting from another planet and had never seen a sport before, and somebody put you in front of a basketball game, one might deduce the sort of rules, and there's this team and there's this team, and they get the ball in the hoop, and then you see your second basketball game, or you see a soccer game, and you sort of use that fixed set of rules to try to figure out the second thing. And again, your analysis will evolve with your increasing number of interviews, and even as your perspective changes over time. As you know, every day there is a new law and a new social climate that comes out, and it sort of changes perspectives and changes the context in which people exist. Or if you're translating a survey from one community to another, from one state to another, those sort of contexts really matter. And so just kind of delving more into the inductive versus deductive analysis. So Inductive analysis is an emergent strategy, as we discussed, where you come in with no predetermined ideas. So this is like you're visiting from another planet, you've never seen a basketball game before. And really, the codes and the concepts are allowed to sort of just come from the data, and you really allow your patients' voices to emerge from the data. That being said, it's worth saying that while this is like the definition, none of us come to anything without some preconceived notion. And so really being cognizant of what those pre-existing biases, preconceptions, thought processes that we come to the table with will sort of help us allow the participants' data to really guide the analysis. Deductive, on the other hand, we start with predetermined codes. As was previously mentioned, you may come with a framework, come with a certain body of knowledge. It's not super common that we come to a question without some sense of what we're going to find. And it organizes the data into categories that maintain alignment with your primary research question. And it may help apply a theoretical framework, develop a theoretical framework, test it, or expand on it, because you're coming to it with this sort of at least initially, theoretical framework. The places where people tend to stumble when they're successfully trying to successfully complete an analysis is the idea that it's okay to be broad and open-minded and go iteratively back and forth between the data and really let that develop into your themes. We talked earlier about the biases and really being cognizant of that. Within qualitative literature, you'll hear this referred to as reflexivity. So really coming back to yourself and your research group saying, what are we coming to this with? What are our biases? As we're talking about this, being able to openly discuss those biases so that they can sort of be reeled in and limit the impact on our analysis. And there are a number of different ways that one might analyze qualitative data. There are more ways than certainly I know, but what you will see most commonly is the idea of thematic analysis, which we'll focus on here, which takes the idea of the codes that we've generated and really creates broader themes that we can then sort of report in a rigorous way within our report or in our manuscript or in whatever presentation we're giving. And I will hand it over to Dr. Schoenfeld to talk about the ways in which this actually plays out.
All right. I'm Elizabeth Schoenfeld. I'm actually the decision editor. I'm a decision editor. I'm a decision editor for qualitative methods for academic emergency medicine. So I read a lot of stuff, and I think that we're throwing out a lot of things at you. A couple of things to remember. Don't do this alone. If you're doing a qualitative study, you should have a qualitative mentor. Even if they live a million miles away and you're only talking to them once a month about what you're doing, you need someone to ask the little questions as you go too. So find somebody, and lots of us are very happy to do that. And there's also lots of other qualitative resources. RLS, which is the SAEM Research Learning Series, has an intro lecture to qualitative methods, and then it also actually has this lecture if you want to go back and see it. But there's a million other resources out there to help you with all of the details and logistics. So mentorship and the details and logistics. And then the other thing that we haven't talked about yet, we're going to talk about here in the logistics, is this is not something you do alone, and this goes back to the reflexivity. There are some specialties and some histories that do it alone, but for the most part, if me as an editor sees a paper where you did the entire analysis by yourself, I'm very suspect, because it goes back to that rigor and you really want to see, did you talk about it with other people? Did you bring different perspectives to it? Because there's this risk that if you're only bringing your perspective to reading all these interviews, that you're missing other things and that your predisposed notions can influence what you're pulling out of it. And the more people you talk to about your findings, the more of an interesting analysis you get. And I'll bring up some examples of that. So we're going to get into the logistics. So you've started doing your interviews, and shortly after you start doing your interviews, assuming you did interviews, you're going to start reading your transcripts, and that's going to be the beginning. And you're just reading them to get a sense of what you're hearing, and maybe during your interviews you took notes as well on some interesting things you heard. So you're starting to see things in your transcript. And some people will read a couple of transcripts together and then go back to them individually. I usually read one transcript at a time, and then I read it very carefully early, and my goal in my first reading of transcripts is to pull out ideas. And they don't have to be organized. I don't necessarily even need to sort of highlight in the transcript and meet them together. I'm just going to throw every idea that I heard onto a piece of paper. Now, if I had a good framework ahead of time, I have a sense of what some of those ideas are. So maybe I'm doing barriers and facilitators to physicians starting Suboxone in the emergency room, and I think that the X waiver is going to be a barrier, so I'm waiting to hear that, and then I hear it, and I throw it on there, and that's one of my code. And then I hear something else, I'm like, oh, that's a barrier I hadn't thought of. That's a new code. It's an emergent code. And my goal in my first round of reading all of these transcripts is that I have another piece of paper, my draft code book, that is just tons of ideas on it, and I'm not that worried about the organization. And this is what you're doing with your first round, and ideally you're doing this with someone else. So two people, either together or separately, are going through each of these transcripts and pulling out all these ideas. And you have to remember that some of these ideas may not be from the transcripts, they may be from what you observed during your interview. You might have actually seen and heard things and had some ideas that came from you reflecting on what you heard. So you're coding and labeling these meaningful things. And your goal is to sort of capture everything, and you're not really worried about organization. You're doing this early in your interviews because say you've done 3 or 4 interviews and you're starting to hear something that you didn't notice. When you're interviewing, you're really like focused on, am I doing this right? Am I asking the right questions? You read the transcripts and you're like, oh, that's another question I should be asking people. So it's okay that you've already done 5 interviews and that at your 5th interview, you're like, I'm gonna go into a little bit more depth about this thing that I didn't think to go into depth on. So this is why you're doing it at the same time as that you're doing your interviews. So you're adding a little bit of depth to each of these interviews as you go. What's meaningful? Well, did you hear it more than once? Was it surprising or unexpected? Did the participants say that it was important? And is it similar to and confirming the existing literature, or maybe it's contrasting, and maybe it's something totally different? A great example of this that I love is I was coding transcripts with a resident about shared decision making in the emergency room, and the resident said to me, wow, none of these transcripts are by my attendings, huh? And I was like, what? And he was like, oh, this just doesn't sound like my attendings. And I was like, in what way does this not sound like your attendings? So he was blinded to who the interviews were of, and I was not, and they were his attendings. And he was like, well, my attendings are not as in favor of shared decision making. And I was like, and so we then got into that, and what we did was we started asking more questions about how does shared decision making change when you have a resident? And we started to get much deeper and much more interesting. And simply having him on the team led to an entirely second analysis that we published as a different paper that was basically the barriers that residents have to being involved with shared decision making based on his perspective of reading these interviews with the physicians. And if I had done that without his perspective, I would have completely missed that. So adding that in was super helpful. So this is sort of like what it might look like. You've got your transcript, you're highlighting stuff. I actually do this first round of stuff in Word because I don't really care. I'm literally just highlighting, putting a box on the side, what's it called, and then throwing all of the comments into another piece of paper. That is not what your last coding is going to look like, because at the end you're going to want to be able to search all your 30 transcripts by the code for, I need an X waiver, and you want it to pull everything up. We didn't really get too much into the software, but there's multiple different software things that you can use for this, and there's tutorials on how to use them. So like I said, your first goal is to develop a code book. So you've pulled all these interesting ideas out. Maybe you finally stopped doing your interviews, and you're starting to organize all these cool ideas that you've heard. If you have a theoretical framework, your code book may already be an outline form, and you may be putting the codes in where you go. And if it doesn't, if you haven't started with a theoretical framework or no theoretical framework fits, you're going to be looking at this big mass of codes and starting to put them together and group them together. What's important, what's less important, you're revising, you're changing. So my code book, so this is an example of somebody else's code book. This is what they saw. This is where, sorry if you can't read it, codes, conceptual frames, and themes. So this is what we saw, this is how we grouped them together, and this is what they looked like. And then maybe your code book looks like this, where the biggest code is this, and then this is how do we find it, and this is when we use it, and then this is when we don't use it. In the end, my code book looked more like this. I skipped B, but on the top it says A, and then A1 is this concept we heard about shared decision making, but then there were some nuances. So so it's like A1.10 is there's the nuance that goes under that code, and then A.11 is this other nuance but it fit under this code. And then as we went through, you can use your software to say, hey, this nuance came up a ton. Like this nuance actually might be really important. So for example, one of the nuances that came up a ton was, is shared decision-making medico-legally protective? And some people said yes, and some people said no, but in general there was this big uncertainty around whether shared decision-making was medico-legally protective. And what that meant to me doing this research was this is an unanswered question that the doctors cared about, and I'm gonna do more research on it. So that was how that little nuance led to an entire next study that I did. And that's the point, right? Qualitative research is supposed to be hypothesis generating, and it generated a bunch of hypotheses. When you're looking for connections, stop me when I'm supposed to give it to the next person, because I don't actually know when that is. I think it's to the end. I go to the end. Fabulous.
I'm like a...
You summarize. Okay, nice. So you're putting things together. Could totally be superficial. Could be that someone says this connects to this, and you're like, all right, cool, that connects to next. Or it could be that you're starting to see some things that fit together that are a little bit more nuanced. Like I mentioned, having a variety of perspective is really important, and you really want to talk through everything. So the way that I describe as an editor how I would really like to see these papers look is that your team went through every transcript once, and that's 2 people at least. So you could have 3 people who are doing it. All 3 people don't need to read all the transcripts, but each transcript was read by 2 people the first time, and then you worked together to develop your code book, and then 2 people applied that code book to the transcripts a second time, and then they discussed the differences. Personally, I don't care about inter-rater agreement. There are some qualitative papers that you'll read that will talk about the agreement on that second coding. This is not meant to be quantitative. I don't really care about your agreement. I care that if you was a disagreement, you talked about it and you pulled as much interpretation out of that data that you could. I don't care what the actual agreement was, but I do want 2 people to be looking at it and going through it. So my sort of argument for doing qualitative and why I think this is really so great and should be the basis of a lot of our research is that you get out of your own head and your own perspective. You may think that you have an answer to something and a reason why an intervention is going to work, but if you don't ask other people, you are not going to see the things that you don't know, right? So you need to get out of your own head if you think you're going to be successful. You're going to identify these issues you hadn't thought of, like the fact that my residents weren't getting trained in shared decision-making because they had different thresholds than the attendings, and the attendings had different thresholds for shared decision-making when they worked with a resident than when they didn't work with a resident. That's relevant for resident education. It helped me identify areas for future research and work, and I felt like I really sort of hear people when I have these qualitative interviews, and then I go back and read the transcripts again, because your only agenda is to hear them, right? You've set aside this time where your goal is to hear them and dig deeper and dig deeper and dig deeper, and I think that that can be really, really valuable, but doing it in a structured way that helps you really capture everything, I think is very helpful. Is that where I'm supposed to stop? Sure.
So thank you. If actually I could add to, I want to add to that, which is to say, I want to stress a couple of points that Dr. Schoenfeld made, which is, one is that this is actually never done alone. Part of the reason that she said was that some people will, there's some models, so I'm trained as an anthropologist, which is how I kind of came to this, is that the model overall is that it's usually single researcher in the field, single author. However, that's a little bit of kind of like a smoke and mirrors thing I can kind of tell you, which is that while somebody is, I'm the person in the field and maybe like I'm the only author on this, there's so much kind of collaboration and talking about it that goes back and forth that doesn't get called analysis, but is in fact how like the analysis is done. You're constantly sort of checking in with your mentors, you're presenting things at conferences, you're constantly sort of refining the analytical process. It just looks a little bit different, but it is, maybe you're sharing it with kind of your participants, but there is never a world in which you go to talk to somebody and walk away and have done a qualitative research or study and like you just kind of did it alone and kind of came up with it, because if the goal is to actually understand, from like kind of going back to the sort of basics of like of qualitative research, if the goal is to understand the many ways of being and to understand the world, that takes many people to do that just by definition. And so that really is something that kind of adds to the rigor. So I just want to sort of highlight that. Should you see something that is single author, maybe that person is responsible for like the ultimate, what is in the paper, but they did not generate that alone. And I think usually that's kind of hidden in the kind of acknowledgments section. The other thing that I kind of wanted to say explicitly is that, you know, people talk a lot about software, like, and there are many things that you know, like there's NVivo and MaxQDA. The analytical tool in qualitative analysis is actually you and your team. So before, like, people have been doing qualitative research for way before there were computers, and the way that they did it actually is like through like printed papers and transcripts and highlighting. And actually, I usually start in Word and printed paper because I usually find that actually much easier. And it wasn't like they were kind of, you know, running into walls and not understanding the world. They were still actually generating knowledge. And so I just want to make sure that you know that while we kind of, that's part of the reason that we chose not to actually talk about software, is because the truth is that the software is a tool that maybe can like help you sort of do things a little bit more efficiently, but it does not do anything to actually like aid in the analysis. Like your team and yourself and your experiences are actually part of the analytical tool. Is actually the analytical is the tool. And so I just want to end by saying thank you. We finished early because we really wanted to kind of give you all time for questions and conversations, and for us to kind of like really make this tailored to sort of your specific interests. And so we'll kind of end there, but these are, oh, excuse me. These are our email addresses. There were two folks that helped us develop, Dr. Westifer and Dr. Wong, who helped with this presentation, but were not able to join us. But we just want to also like acknowledge their contribution to this. But you're also you're welcome to email any of us or them as well. So thank you all.
I'm gonna add. You can clap too. So as the decision editor, if you are interested in qualitative research, I'm always looking for qualitative reviewers. And so just being interested is a great place to start. If you're interested in reviewing, I would be very happy to have you. And one of the nice things about it is even if you're very early in your qualitative journey, you get to read other people's reviews. You get all of them back. So it usually goes out to 3 people. Sometimes the people I send it to will be a content expert and not a qualitative expert, but there will always be 1 or 2 people who are qualitative methods experts. And so you can read the paper, decide for yourself what you think, and then also read what the qualitative methods expert said. So if you have any interest in reviewing, I would be very, very happy to have you on our list.
Yeah, thank you. I'm going to stand because I had a hard time seeing that side of the room, so I don't know if I'm the only one, but.
All right, questions? Yeah.
Question about the theoretical frameworks and conceptual models. So there are clearly ones that are like ones we hear about and see quite a bit, but also like review papers where a lot of conceptual model and some really confident about it and cited. I've never heard about it because I'm not in that world. Like, how do you evaluate maybe even as a reviewer like a good conceptual model for performance?
So I actually, this is a very good question. And as she asked as a reviewer, so maybe you can take that part. But there are these nice books. So there's like, I think there's one that's called like the Behavior Change Wheel. Like there's this 78 or something theoretical models put by Susan Michie, I believe. M-I-C-H-I-E, I believe, or maybe their team there. She's from the UK. I met her at a qualitative research conference. And she identifies, like, since it's health related, so identifies all these theoretical models that have strengths and weaknesses and what you're phenomenally trying to understand, how to better to use it. So I've used that for grants, and I didn't know about, I mean, she's a person who's in the qualitative field as a PhD. I didn't know about 73 frameworks at all. I knew about 10, maybe, right? So my point is there are these sorts of things and some that you can find. And then there's some that are just in vogue and you got to use them. Like if you do implementation research and you don't talk about CFR, people are just going to say, okay, well, what are you doing? And so for us, I think that's the way that you decide, right? That you say, okay, I'm going to explore, broadly speaking, find a handbook, but then recognize my field and all the papers I'm reading are using this framework, and so I should at least learn the inners outs of that. Because oftentimes I've been pushed, I'll just tell you on the other side, that a reviewer said, well, why didn't you use this one? Why did you use that one? And so I can pull up at that book and say, well, because the strength and weakness was this, I actually know a little bit about it. That's why I used it, right? So.
So I have definitely Googled theoretical frameworks and like whatever thing that I'm thinking about and like just look through all of them. So I actually think it's just like face validity. If you're explaining your research question and like for shared decision making, it's a physician behavior. Okay, so I'm looking for theoretical frameworks that have to do with behaviors. There's a ton of those, and some of them fit and some of them don't fit. So the one that we presented before fit really well. Skills, attitudes, intentions, external environment, barriers. And so if somebody is using a theoretical framework that I haven't heard of when they write a paper, that I'm totally fine with that. I would like a picture of it. I don't want them to just say, I use the blah, blah, blah framework, and then I have to go look it up. They should actually put it, particularly because qualitative research is so new to so many people reading a journal, you should have a picture of that framework, and I should be able to see why your question fits so well in that framework and how that framework led to the development of your interview guide. Because the theoretical framework is helping with analysis, but what it's more helping you with is what that interview guide looks like and making sure you're asking all the right appropriate questions and you're exploring. So some of the theoretical frameworks are like this word and an arrow, this word, and you're like, I don't know that that's actually helping us that much. So I want to see it, and I want to say, to myself, oh yeah, that makes sense. I see why they chose that for this. And the flip side of that, if the theoretical framework doesn't exist, like you really didn't find anything, then your research is essentially grounded theory, where you're trying to come up with a theoretical framework based on what you see. And I'm okay with people doing that, but when they do that and there was a million theoretical frameworks that would have fit, then I just feel like they didn't look and they didn't have enough mentorship. So you're totally welcome to do that, but you should definitely spend some time trying to find an appropriate theoretical framework. And then you can change them as much as you want. The house that you saw earlier was 2 implementation theoretical frameworks because I was annoyed that CFER doesn't put enough emphasis on interpersonal and personal factors. So we took and I shouldn't take credit for this was Westifer, took the theoretical domains framework and shoved it into CFER because I felt like that they had to go together. One didn't work that well without the other one.
So I completely agree with all of that. I will say, I would say 2 things. One is that one should know your audience. So, if you're kind of publishing in AJPH, your audience, like in the Journal of Public, I forget what it is, the AJPH journal, the American Journal of Public Health, thank you. Your audience is very different than if you're publishing in the Journal for Urban Health, and it's very different than if you're publishing in AEM. And so I think that that's part of you should know who is reading this and where kind of how much explanation of the theoretical framework there is. I will also add that it is extremely rare that there is not a theoretical framework that either exists or can be adapted very slightly to actually fit what you're doing. And so I would also say often to me, when I review something and they say this theoretical framework didn't exist, or there is nothing ever been done about this, I think you probably just only searched the emergency medicine literature and you didn't search maybe in public health, or you didn't search in maybe in sociology, or in there's humans have been around for a while. What the likelihood that you came up with an idea that is brand new under the sun and it was just you, that's great. But I just want you if that's sort of where you're going, that you can't find anything, I just want to make sure that you have pushed yourself a little bit to look to other things to say, is there something that we could have adapted or thought of to actually expand our understanding and to kind of engage with that? And that is, I think, especially important if you're publishing in journals outside of emergency medicine. Yes.
Nursing journals, nursing research is adjacent to our field, and they are very good and robust about the theoretical framework.
Absolutely.
Sometimes you might not find that in our clinical framework.
Mm-hmm. Yeah.
So this is what the next talk after this is on communication science, and you have a plethora of resources to find those frameworks based upon thought parameters, your projects, and your outcomes. If you want to learn more about that. The question is about one of us first approach to shove two of them together. How do you know without validating that you're measuring anything?
I can't claim that I do, but if you look at them, if you look at CFER, CFR talks about interpersonal stuff, it just doesn't get into details. And then TDF really gets into like the details. So they really look like they fit together. It's just like CFR really focuses on the things that it focuses on. It's like external and culture and process and this sort of thing. And maybe that's true if you're talking about implementing something that doesn't have a ton of emotion. But then when a lot of the stuff that I like to work on is like a little bit more emotional. And so if you think that there's like gonna be a big personal component, then adding TDF, like it just sort of makes sense. So yeah, I don't know, but I don't feel that bad that I don't know for sure that they sort of fit together. I think they look like, to me, they look like they fit together because they're sort of doing two different things, and the TDF is just more detailed on a part that CFR isn't as detailed about. Yeah, no, I don't think so. And I think someone else could argue that, like, for their particular implementation question, you need to focus even more detailed on the external factors of CFR. So CFR is, I feel like CFR is a bigger framework and TDF sort of fits within it. And so depending what your question is, one of them may be more appropriate than the other. And we had a big question, so we sort of put them together to look at both things. And then, to your point, I ignored most of CFR and focused on the interpersonal stuff because that was the stuff that interested me and where I thought the biggest barriers were when we looked at the broader picture. So, good question.
And just so you know, academic firms have said that the editor chief, we are going to raise the bar significantly about explaining your choice of framework. So you do know your audience will know that academic EMs may be competitive with those other journals about how much depth we expect explain.
Thank you. That's really helpful. Thanks.
I will add, sorry.
I was just going to ask if there are books or websites you recommend to use as a reference as you analyze, and I know you mentioned them on the frameworks, but.
I can recommend many books. I have read them. There is nothing like actually working with someone who actually like has either worked in your field or like worked with the questions or done the type of analysis that you're looking for. And sometimes I would actually add that sometimes it's helpful that the person is familiar with familiar in some ways with either your analytical method, but has maybe like a little bit of like distance, you know, that, so to get like a different perspective to kind of look at it. So like similar to kind of what Dr. Schoenfeld said about having a resident and like having kind of like that extra perspective. So there's a number of them, but like I think really like it's the process is actually like more important than just kind of like reading it and like seeing how you're doing it. But I'm sure there's.
Sorry. I am very much a person who likes to have like a manual with me, and so while I completely agree, there is a book that I really like. It's most of my work is mixed methods, but in the qual component does like thematic analysis. There's a book just called Thematic Analysis, and it's got this like sort of like yellow like X thing for dummies type appearance on Amazon that I actually think is like a really nice handbook to say like, somebody said this word to me, I'm gonna go like read the 4 pages on it, or like somebody said for me to do this thing, what does that actually look like? And they have like pictures of it. So.
I might offer something else. That combines theory a little bit with the research questions. There's John Cresswell's book, right? There's like 5 approaches to qualitative analysis, something like this. He talks about, well, are you doing phenomenological approach? Are you doing this or that? So he gives you both the mechanics, but a little sense of, okay, when you're going in, you got to understand which reasons you're going in for. Let's just say that easy way. And it was given to me actually by a mentor who was the journal editor of Mixed Methods Research, who has now passed away. And I found that as a fellow, that was just helped me understand what I'm doing. So it's maybe an elementary book, but it was really phenomenal. And I give that to my own fellows.
The SAEM website with the previous qualitative talks and maybe with this talk, but I had created for the last qualitative talk just a Google Drive of articles and a list of both books and articles that you need to be aware of, particularly like checklists for the rigor of your qualitative research. And obviously, you look at the checklist as you're designing your study, not simply as you're writing your manuscript, so that you're making sure you're hitting the things on the checklist. But just like the rigor with the other studies that Dr. Carpenter was talking about, there are specific checklists for qualitative research that you should be following as well.
It's kind of harder. When I was there, there were no checklists.
I think the checklists are helpful because I think the checklist is like a recipe, right?
Yeah.
This is what you need to do, and you know what? You do not have to do every single thing, but you need to explain why you didn't do that thing. So a great example is member checking. Member checking is going back and checking in with your participants to see if you got the gist of what they said. So when I interviewed physicians about shared decision making, that was not hard. I sent them a summary of what they said, and I said, "Is that the gist?" And what was lovely is that they would reply and give me another example. They would reply and give me another great quote. It was lovely. But when I interviewed people who were in active stages of drug use in the emergency room, and I was not going to recontact them, I did not do member checking, and that was why I did not do member checking. But we did a different type of member checking where we brought our results to a different group of a similar population and asked them to weigh in on the results. So we just did it differently.
Yeah, which goes back to the point about kind of context and there's a certain amount of the rigor, but also flexibility. So you shouldn't do it. You shouldn't skip it because you forgot. The point.
To Dr. Schoenfeld's point, that's why you pull up the checklist and you're like writing the grant.
Yeah.
And you're like, oh,
Yeah, generating the question.
For every
Or yeah, but also does this make sense, right? Like, does this make sense in the group or the context I'm looking at? Was that it? Hang on. Sorry, go.
Question about like thematic saturation, stopping the analysis. So especially that attitude of like open-mindedness and allowing people to kind of compile. At some point, of course, you do have to stop yourself, but kind of thinking about like a situation where maybe you or your team doesn't have that far of a perspective. It's almost like a you don't know what you don't know kind of situation.
Yeah.
So how do you risk not having really include your
Yeah, that's a great question. I'm curious to hear what others have to say, but I think that there's some philosophical differences in that, and it really depends on kind of like your background. So one of the things that you could, maybe if I could ask like an adjacent question is, what do you do with an outlier? If 20 people told you the same thing and one person was like, nope, absolutely not, and they felt very strongly about it. If you're doing like kind of straight thematic analysis, like you can kind of ignore that. Some people will tell you that you can ignore that as an outlier. If you're doing true grounded theory, what you're actually supposed to do is go back and find other people that agree with that person so that you can kind of saturate the themes. There is actually a paper called, I don't know how many of you use it, it's called How Many Interviews Are Enough? It's by Greg Guest. I will tell you that what they tell you is that you will reach thematic analysis between 15 to 20 interviews. The asterisk that nobody else tells you is that you don't always saturate variation within the themes at 15 to 20 interviews. And so like some of it is like actually it's not just what people are talking about, but what they're saying within those various themes. And so I just,
So one of the things that I say is that for thematic saturation, a priori, after you've done your interview guide, you're going to say, okay, I want to know this theme. So when people, or as a reviewer, but also as the one who's doing the work, this theme is the one that I'm going to saturate around. There might be, right, or this box, let's say, this domain, right? And the rest can be emergent themes, and when I do my reporting, I'm going to talk about emergent themes, and so that's exploratory or hypothesis-generating work, but this thing is where I've a priori decided that if we've gotten enough of this, we're going to stop interviewing, right? In this box or just domain or this specific question. So I'm very, let's say, the word isn't militant, but intentional, thank you. Very intentional about that. And then the reporting has to follow that, right? So you can sort of say that, okay, yeah, I did this a priori, and the last piece I'll say about this is that I have done 8 or 10 interviews a priori, and that's stopped. Although I thought I was going to do 20, because I didn't get anything new on that specific area, and I can convince a reviewer that that's what it is.
So, I mean, this could be a whole talk in itself. I think it's super interesting. I will say, as the AEM qualitative person, I'm going to suggest, and I have talked to AEM about it, about having a line in there that says that we are very hesitant to take qualitative research with less than 15 because of the original study. If you have a very specific reason why you think 12 was enough, but my own personal experience is if you're starting to see thematic saturation really early, maybe you're just not asking broad and deep enough questions. Like yes, I have things that I'm looking for in terms of my themes, but I'm asking these questions because I want perspectives that I haven't heard and haven't thought of. And so if I'm already feeling like I've heard everything by 10, then maybe I need to revise my interview guide. So for example, recently I have a study where we're interviewing people, and I'm not doing the interviews because we're interviewing them in Spanish. And so that means that the person who's doing the interview is learning from me as we go through the transcribed transcripts. And so that person is a new interviewer, and those interviewers may not get it, each interview may not get into as much depth. And so I don't think we're going to end up stopping anywhere near 15 because we're learning as we go and we're getting better at it as we go. There's another paper called like Shedding the Cobra Effect, which talks about thematic saturation as well, which I think is helpful to reference and to look at some of these things. But there's a lot of subjectivity, and I think that people should think of 15 as a minimum, unless you really think that this is such a novel thing, a novel and rare thing that you're exploring that you couldn't possibly get to 15 and that you can get a lot without 15. The other thing to think about is your sampling. So if you're doing purposeful or purposive sampling, did you actually have a goal for your N for sampling? Did you get enough, if it's physicians, is it early career, is it late career, is it Midwest, is it male, is it female, is it community, is it academic? So you also want to make sure that you've gotten enough people in the different strategies. So for me, if it's drug users, and I'm talking about methadone and Suboxone, I need to get people who've tried methadone, I need to get people who've tried Suboxone, I need to get people in different areas of the country. And if you limit that too much, then you're definitely limiting sort of what you're finding. So that's my thought.
I would add, I think context really matters in terms of who you're asking and the question that you're asking when you're talking about numbers. And I think that from where I think if quantitative analysis is understanding people through numbers, then qualitative analysis is understanding people through words. And sometimes, depending on who your group is, you may not actually have 15 to 20 people to interview or need 15 to 20 people to interview. So for example, if you are studying an experience around a very rare like mitochondrial disease, maybe you don't actually have access to like these 15 to 20, like family members, right? And so maybe I think what I would say is if you think you are going to reach thematic saturation sooner, or that your group that you have access to is smaller, what I would say is that your interviews should be designed to be more in depth. So maybe instead of a 30 to 45 minute interview with a very small group, perhaps what you should be talking, kind of having a more like maybe like a life history or like a more kind of robust, like in-depth interview that goes on for like 3 or 4 hours or something of like that nature, or that you're kind of interviewing like maybe like family members who don't necessarily have that experience but are adjacent and maybe can kind of like triangulate the perspective. So I think that it depends a lot on who you're studying and what you're asking. So.
I want to back off one of my statements before. It does depend on what you're doing, because if you're doing qualitative interviews to understand something very specific, and it's part of a bigger project, I don't know that you need 15. If you're like implementing something and you're looking for a very specific feedback about something, then maybe it's not necessarily 15. But then you're not necessarily publishing that particular one question. You wanted to do qualitative to keep it open, but you're publishing it as part of a bigger development project where maybe you did interviews and you changed something and then you did more interviews or something like that. I think we have to be done. Thank you guys all so much for being here at this time of day on Friday. And there is QR codes on your way out to give us some feedback, because we would love to hear what was useful and what else you might want to see next year.
Thank you.
You should stay and listen about implementation science, which you guys know that you guys got the top bill of the entire program because they put the best thing last to try to keep people here.